Hi, how are you? I'm Elena. It's nice to meet you. Please come and take a seat. How are you feeling today? A little bit anxious? All right. You don't have to worry about a thing. I am the cardiologist here at the hospital, okay? We're just going to run through some quick tests just to make sure that everything's working as it should. There's nothing to be worried about. I'm here. If you're feeling really anxious or nervous and want me to stop, please let me know, okay? Wonderful. So I'm just going to have a look at your form, and I'm just going to ask you a few questions, okay? All right. Yep, so nothing too personal, but we do have to know a little bit about your family history, okay? All right. All right, so have you had any issues with your heart? Okay. No palpitations, feeling if you're getting anxious or having a panic attack, do you feel that your heart races quite a bit? Okay, and how long does that last for? All right. It certainly does feel like it's you're going to have a heart attack. I've had a couple myself, but rest assured, no one's actually ever died from having a panic attack. It's just learning how to decrease the symptoms, and if we do have one, to make sure that we're breathing properly. Has anybody in your family ever had any cardiac issues at all? Okay, wonderful. Do you drink? Okay. How many would you say throughout the week that you drink? Okay, perfect, thank you. And are you a smoker? Okay, wonderful. And how would you rate your diet from 1 to 10? 1 being very slack and eating, a lot of takeaway foods, fatty foods, those processed foods, and about 10 is where you're eating completely clean, you're not snacking on those types of sugary foods, fatty foods, just a well-balanced diet, okay? Oh, it's completely fine to have some days where you're eating fast food. It's just, if you're eating it every single day, you can start to develop cardiac issues in the future. So it's just good to make sure that you're on that well-balanced diet, which is what you do. And are you taking any medication? Okay, and how much of that one do you take? All right, and that's daily? Okay, good. And sorry, I forgot to ask you, do you exercise? Okay, right. Perfect. Okay, good. I think we'll get started. All right, so I'm just going to pop everything down here. Put some alcohol rub on. Okay, so I'm just going to have a look at you first, okay? Just as you are. If you can just look straight ahead for me. Okay. Good. Perfect, thank you. And if you'd like to place your hands up for me. I'm just checking the skin colour, making sure that we have no edema, making sure that the blood circulates back into your fingertips. Which they do, good. And just on the other side. perfect. And I'm just feeling around your hands. Okay, good, perfect. And if you can please, if you can do this for me. So just with your index fingers, just right here. Okay. All right, good, very good, thank you. And I'm just going to quickly check your eyes. All right, so if you can just look straight ahead for me, I'm just going to come in a little bit closer and I'm just going to flash the light into your eyes. So just like that. Okay, good. Are you still feeling comfortable? Okay, good. And just coming to the other side now. Okay, so just keep looking straight ahead. All right. Good. Excellent. Perfect. Now, if you can just have a look at my nose, I'm just going to flash it out, back in. And your pupil dilation is looking fantastic. All right, so what I'd like you to do now is I'm just going to move the light around just a little bit and I want you just to follow with your eyes, so keeping your head nice and still. Now, if you get any blurry vision at all, please let me know. All right. Good. Okay, perfect, thank you. And I'm just going to come a little bit closer now. And I'm just going to pull your eyelid down. Alright. And if you can just look straight ahead. Alright. So, if you can just look up for me. Okay. And look up and right. Good. And up and left. Doing a very good job. Perfect. And look down. Okay, good. And again down left. Perfect. And down right. Okay, good. And just to the other side. So I'm just going to place that eyelid down. So I'll get you to look down for me this time. Okay, good. Now if you look down right. Okay. Okay, good. Look down left. Okay, good. Perfect. And if you can look up for me. Great. And look top right. Okay. And look top left. Okay, pupils look fantastic. Okay, good. Thank you. All right. So I'm just going to pop on some gloves now. And I'm just going to have a feel of your pulse. Okay, so if you can just extend one of your arms out for me. Perfect. And we're just going to have a listen. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, good. And just on the other side. So extend your arm out. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and I'm just going to feel under your, just a little bit higher up. I'm just going to feel it here. 2, 3, 4, 5. Doing a good job. Just take some nice deep breaths in for me. Okay. It's a little bit fast, so we're just going to slow down that breathing because you're a little bit nervous. Okay, so nice. Okay, and I'm sorry, I'll just check on this side. Extending. Okay. Okay. So I'd like to have a listen and test your blood pressure now. Okay. So, which arm would you like to go? Okay, good. I was just testing you. I have to check both of them. We'll start with this one here. Okay, good. Just place this in here. Okay. All right. So just breathing normally. Okay. Okay, good. Perfect. And just on the other side. So I'll just pop this around. Okay. So I'm just breathe normally. Okay, good. Perfect. Fantastic, thank you. All right. Okay, so what I'd like you to do now is I'm just going to place your robe just down below, okay? Just pop it here. Okay, good. Thank you. So we're going to have a listen to your heart now. Okay, so what I'd like you to do is just take in some nice deep breaths in. Okay, so I'm just going to come a little bit closer. And we're just going to place it right here. Okay, so you can take in some deep breaths. Good. And keep going, you're doing a very good job. Okay, good. And here. Wonderful. And let's go about here. Okay, good. Here. Okay, perfect. And I'm just going to go around to your back, okay? Okay, so the same thing again. Just pop that there. I'm just going to place this on your back, and I'd like you to take some nice deep breaths. I'm just checking your lungs here. So nice deep breath in for me. Perfect. And again. Okay, good. And just over here. Good. And over here. Okay, perfect. Thank you. That's all sounding very good. I'm just going to get you just to extend your arm out again. I'm going to place this on your arm, and I'm just going to listen to your pulse. So, Just extend that arm for me. So I'm just placing this on here, and I'm just going to take my fingers and just press here. I'm just going to feel for that pulse. Okay, good. Wonderful. Okay, and just again on the arm, so extend that arm for me. Make sure it's nice and floppy as well. Right, so pop that here and place that here. Okay. 4, 5, 6, 7, 8. Okay. Wonderful. Thank you very much. Okay, so I'm going to come a little bit closer and just feel around your lymph nodes. Okay, so I'm just going to go right to the neck and have a little feel. Okay, we're just going to feel for going to feel for that section here, and we're feeling the pulse here. Okay, good. And no pain when I move around here. Okay, good. Okay. Wonderful, thank you. So I'm just going to get you just to lie down now, right? We're going to be just feeling your tummy area, and we're just going to make sure that there's nothing going on there if it's feeling awful, no hard lumps, things like that. Are you comfortable with doing that? The heat's already come on, so you should be nice and warm. So I'm just going to pop you back, okay? So place you here. Okay, perfect. Thank you. Okay, so I'm just going to open your gown just a little bit more. So we're now exposing the stomach area. Okay, so I'm just going to press on it, right? Okay, so I'm just going to have a press here. So, okay. Right. Does that feel uncomfortable? I'm going to go a little bit deeper, all right? So, how about here? All right. And here. Okay, good. Tickles a little bit. It's all right. Okay. All right. Thank you. I'm just going to have another feel of your heart. So we're just going to place that down here on your stomach, and if you just breathe normally for me this time. Okay. Good. Perfect. Good. That feels quite nice. And I'm just going to place my hands just on the solar plexus and just place that here. Alright. Good. You're doing a very good job. Okay. Okay, perfect. Thank you. I'm just going to place this back over here. Okay, and I'm just going to place you back up. Wonderful, thank you. So I'm just going to write a couple of notes here. So there's no particular issues with your heart at all. It all sounds completely fine. There's no tachycardia. There's nothing abnormal that I can hear there. You had a few stomach noises. I'm not sure if you've eaten yet, but you might want to have a nice big meal. But that sounded completely fine as well. It's just normal gut noises. All right. Well, I think that we're done. Okay. Do you have any other questions for me? Okay, so the next time you want to come in, that's completely up to you. We tend to deteriorate as we get older, or if we're obese or anorexic. Certain conditions can affect the heart greatly. That's like smoking and alcohol, etc. You know, anything can pretty much affect your heart. So, I mean, you can come back next year if you like. Okay, we can do another booking just to reassure you and make sure that everything's ticking along nicely. All right? Perfect.